Next on our agenda for today is the award ceremony of the Hilfenhaus Award. The award will be handed over by Oliver Schmidt. Oliver is the Chief Executive Officer of CSL Behring Italy and an important contributor to the work of PPTA Europe, where he is now the chairperson of the PPTA Europe board. Oliver, I hand over to you for some words about the award and for the disclosure of the winner of the 2020 Hilfenhaus Award.
Yeah, thank you, Martin, very, very much for the nice introduction. Yeah, hello, everybody. My today's activity is to present you the award winner of the 23rd edition of the Dr. Joachim Hilfenhaus Award. This award, which is normally given at the IPPC and should have been given this year in Berlin in March, is named after Dr. Joachim Hilfenhaus. He was the first chairman of EAPPI, Viral Safety Working Group. So Dr. Hilfenhaus was an internationally respected virologist who worked for the former Behring worker. The nominated individual, which will today also be awarded, should be one who has made an outstanding contribution to the provision of safe and efficacious plasma-potent therapies. I already mentioned it's a 23rd edition. So in the long list of award winners, we have important scientists as Professor Ingemar Nielsen. We have Helen Chappell. We have Professor Manucci and others who clearly show how important this award is. This year's award winner is a very particular one because I think it's the first time that PPTA decided to give the award to an important scientist who unfortunately passed away during August last year. I have the pleasure, despite all, to present to you this year's award winner, Professor Marco Cicardi from Milan University. Professor Cicardi was a very known specialist, worldwide respected in the area of HAE. Unfortunately, due to his early death, today we have only the chance to listen to one of his, let's say, former students, today an important scientist in the area of HAE, hereditary angioedema, and to his daughter, who also decided to follow the path of his father. So now you will have a short spot, a video clip with Dr. Andrea Zanichelli and Dr. Carlotta Cicardi, who will present both the scientist as well as the father.
Buongiorno, my name is Andrea Zanichelli. I worked together with Marco Cicardi for about 20 years on hereditary angioedema. I met Marco when I was a student at medical school. He was already a professor at the University of Milan, and he was working together with Professor Agostoni that started hereditary angioedema in Italy. Professor Agostoni was the first to diagnose a family with this rare disease in Italy, and when Professor Agostoni retired, Marco took his place and became one of the most important physicians and scientists in the field of hereditary angioedema. Marco would have been very proud of this award, and I would like to thank the Plasma Protein Therapeutic Association and the Global Plasma Summit for this. One of the most important treatments of hereditary angioedema is a plasma-derived C1 inhibitor. When I started working with Marco Cicardi, we used to treat only severe attacks with plasma-derived C1 inhibitor. Later on, we started to treat every attack with this protein. In the last years, we also could use plasma-derived C1 inhibitor for prophylaxis to prevent attacks. Marco was passionate about his work and he wanted the best for patients. And he founded a network of Italian centers to bring specialists and treatments to patients. After that, he founded also an international network and international register to collect data about hereditary angioedema to better understand the disease and to give the best treatment to patients. Today, together with Italian and international colleagues, we are continuing his work, his research, and we try to give the best treatments to patients. So thanks to Marco and to all he did and to all he left to us.
Good morning, I'm Carlotta Cicardi and I'm the daughter of Marco Cicardi. I've started working with my father in 2018 and it has been a great opportunity because I've seen that he was present with his patients as well as he was present like father for me and my little brothers. Now I'm continuing his work with the HIE Association and with the HIE Registry that in the last 2 years has been his main project. I'm very happy because as well as the support of my family, now I have a support of a second family in his colleagues and in his patients.